I really appreciate all of you guys coming. One of the things that's really important to me is collaboration, and collaboration not only with other allied health staff, but with people from the community, and also people from other health professions as well. It does go a long way in getting better health outcomes for our clients. So I'm really excited that you're all here, and Dr. Noel Collins is a consultant psychiatrist from Albany Hospital, and he's going to share with us some of his expert knowledge on mental health and tips that I guess you can give us in addressing mental health issues that we face, but also ways that we can help ourselves and give back to our clients as well. So it is really casual, so please just ask any questions as you like. I think we've got some questions to start off with, and then we'll go from there.
I'm going to stay seated down as well.
Yes.
It's nice stand there. But thank you for the introduction. It's pretty sad. I work with Tom, and I think one of the themes today will be about mind-body splits, I think. So I suppose I'm the mind, you're the body. This is the split right here, because Tom's a geriatrician. I should also just say two things, that I also did some studying in cognitive behavioural therapy many years ago, so I have sort of interest in sort of psychological work as well as other things that you think a psychiatrist might do beyond just prescribing an antidepressant or whatnot. And the other thing too that's always interested me more is multidisciplinary education and also working. So obviously medical education is important, but I've never been as interested in teaching the registrar's stuff as the rest of my team. So my team in Albany, I do older adult mental health. It's quite a small team, but I have a social worker, 2 nurses, and Tom and I meet and we've got OT. So I've always been very interested in working with other allied health professionals. And I suppose this is a new frontier for me, sort of talking to you guys, coming from a different sort of discipline and experience. And I kind of hope that this kind of work will be kind of the frontier of things. Because it's crazy. I was just thinking this morning that I've never actually spoken to a group of people from chiropractor backgrounds or physical therapies. And I thought, God, well, why is that? So it's very interesting in itself. As Priya said, she sent me some questions just to sort of get us going. And this morning, while I was having a pot of tea as big as my head, I was just sort of putting down some thoughts that I thought might be useful to you. And I have a tendency to over-prepare, so I've tried very hard not to over-prepare this, and it's sort of me going on and on and on. But so should I kick off with some of your questions?
Yeah.
Your first one was, we deal frequently with clients who may be experiencing mental health issues. What tips would you recommend for musculoskeletal health professionals to address the relationship between chronic pain and mental health? So small question there.
Start off with the
Actually, I think what I really some points here, but I thought it's always good to sort of use your own experiences to kind of conceptualise things. And I was thinking about when I've ever had back pain, and actually the 2 times that I've had sort of back pain that was enough to really affect my quality of life were points where I was changing jobs. So straight away there was some sort of stressful circumstance, thinking about how to adjust to that, and having sort of noticing it, experiencing it kind of in my back. And funny enough, I've only seen the chiropractor once, and it was kind of one of those power sessions that I didn't think I never needed to go again. And he was the first person that just said, well, I see this quite a lot, that sort of certain muscles sort of in the back are kind of more adrenalized than others. And I was like, and by this stage, I'd done my medical training, my psychiatry training, my first year as a consultant. And I thought, I never thought about this, and that came from a personal experience. And just knowing that was helpful. So I think the first point I put is about sort of curiosity and trying to instill kind of curiosity in the people that you see about that relationship. Because some people have never really thought about that. I think Western society is really rubbish about sort of mind here, body there. I think Eastern cultures are much more integrated. And I think we're getting better at it. And of course, some people will be curious about that, or, you know, there's a wide range of people that we see, don't we? Some people are almost experts. They come into you and they give knowledge to you, and you're like, oh gosh, this is not how it's supposed to be. And then you've got other people that you assume that they kind of would understand that. And it's only when you start a conversation about that, you know, the body is, you know, is a source of strength and wisdom, but it's also a platform for distress. And sometimes when emotions are so unacceptable to us, to our minds, it is just experienced through the body. And it always surprises me that when I just say it pretty much in those terms, people have never thought about that. You know, and I'm an older adult psychiatrist, so all my patients, my younger patients start at 65 and go all the way up. And I've got, you know, someone that I'm seeing at the moment who's 70, you know, lots of somatization, lots of preoccupation, you know, with his coccyx, and there must be something wrong. And I was, and talking to him about the fact that, you know, that your two sons are at war, you know, estranged from you, these other problems are going on that we've never spoken of, that could be expressed in the back. And it was very much like he never thought about that before. There'll always be strong projections about cure and care. And so for this person, there's a lot of investment in the idea that it's all the pathology is just here. And therefore the projections on you, if you just sort this out, everything will be fine. And those projections can be really, really powerful for several reasons, partly because of that lack of insight into that relationship between mind and body. But often people will be coming to you that had these pains for months/years. So there will be distress, there will be hope that you're the magical professional that will finally sort this. And they've probably been on a journey where they've consulted different people along the way. So it's quite natural that when you're starting a new beginning with someone, some sort of therapy contract, whatever it is, that there'll be that kind of projection onto you. That's just, I think, helpful to reflect on. You can't stop people projecting what they want onto you, but you can kind of manage that, I think. And I'm sure you're already thinking about customers that you've seen before where they come in and it's like, oh, you know, I always get really worried when people come in and say after 40 minutes, and it rarely happens to me, but oh, you're the best psychiatrist I've seen. I'm like, well, that's so good. So I think you know, you have people say you're the worst. I think anything between those extremes is fine, generally. And the other thing, so again, this is just discursive thoughts about all this. So with all these projections and expressions of anger, and you know, when you start to sort of open the lid of that box, it will all come out. And I think the role is just to sit there and not necessarily have to kind of respond to it all verbally, because people will unpack in front of you in a kind of explosive way. But just model that you can manage that. And I think actually what I'm saying, you probably all do anyway. You know, you've come into this profession because you are people, and you are used to people kind of falling apart in front of you and trying to rebuild them slowly with your craft. And you don't have to they might come out with this and that, and this is terrible, whatever. But you can just sit with that and just show that you can cope with it. You don't have to respond to everything verbally. Even though they'll want to, gosh, this is happening. So sometimes I think it's like being like a hairdresser, you know, like they're sitting there chopping away, and my daughter doing this, and they all just sit there happily snipping away, and oh well. So you know, so I think if you're a people kind of person, profession you are, you're probably quite good at that already. But boundaries are important, and I suppose some of the boundaries are very obvious. You know, time boundaries. You know, people come into you, this is the contract, this is how long the sessions will be, this is how many sessions we're contracted to do it. It's important to maintain those boundaries, not just because that's important for business, but people need boundaries and consistency, and that will be helpful. So if they're starting to kind of unpack and unload, and it's 39 minutes into a 40-minute session, you still have to sort of just from session one, okay, we're finishing now, I'll see you on this date, and just maintain that consistency. Consistency is important for everything. Psychotherapy, you know, what you guys do, because people need structure. If they feel like their life is unraveling, structure is something they can hold on to and scaffold. And it's not you being mean saying that they've just told me that their daughter's marriage has failed and you're saying, right, it's time to go. you've got a little bit of flexibility, but you have to maintain the boundary, and that will go throughout. So boundary setting on that first treatment session is critical, because then it will be easier for you to maintain that boundary. I would say this to my registrars who are doing psychotherapy training, that they have to absolutely maintain that boundary for a number of reasons. But people will push.
Yeah.
Would you say, just on that, Noel, that putting that in place actually, sometimes from a caring perspective, feels like you're pushing away, like from the inside, except it actually seems to drive trust in that therapeutic relationship of them going, oh, this person is actually really clear on that, and I honour that. Now, it doesn't happen in every case, but I would say the majority of cases that they go, well, I honour that, and that is actually what I need in reflection. That might be down the track, like not right at that moment that they're having that, but then they go, oh, this is actually, hey, I've got my 40 minutes in here, and I'm gonna this is my priority now, and this is what is like right on top of my radar now to actually ascertain what I need help with.
No, it's key.
And it is that, and it leads to structure.
Because again, some of the stuff that I'm talking to you about now is, again, the stuff that I would talk about with the registrars just starting on a psychotherapy long case, where they'd see someone for 40 sessions over a year or less. But and there's certain components that are essential, and those boundaries are essential. Because essentially a lot of the stuff that you guys do, and a psychotherapist, is quite similar, really. You're doing the physical stuff at the same time. There's a lot of crossover. It's quite interchangeable.
But we don't have the training of being a psychiatrist or a psychologist, so it's very difficult for us to know what to do when someone does come in and unpack all of these questions in front of us. And boundaries, obviously, is a very
that's
important
one way.
step.
Especially tragedy, like deep tragedy, and you're just listening, and all you can do is listen, and it's very hard to. Well, we don't know.
But that's very powerful in itself.
It's sort of like a pat or a hand, and that's it.
Being kind of present and pushing on.
That's it.
Quite literally, I suppose, in many respects. But that's very powerful. It sometimes feels like it's the soft start side of things, because these days there's a sort of quasi kind of fluency about mental health, and you're supposed to say this and do that and do this, but actually it's nonsense. Just being with someone, letting them express themselves, being consistent is very powerful.
And a person face down, whether it's half an hour, can talk because they're not directly looking at you, and they can just unpack.
And it might be the most powerful experience that person will have in that week, or over that therapy contract, the most sort of powerful experience they've had in their life. Because the majority of people don't go to counsellors.
And they've got time.
Yes.
Some days are harder than others on our perspective. Like I'm 14 years, so I'm pretty good, in, out, great, keep going. But some days you just go home and go, that was a heavy one. Just shake it off, go for a walk, whatever you need to do.
So you're doing my work for me. So the self-care is very important. And again, once you've been doing it for a while, you find your own way of managing that, because there are those sort of strong projections, and you're left in the day, someone's angry, and it can be in any context. My partner works in the bank, and when people, if he has an angry customer or two, he comes home with that. But now they're a bit older, we're able to let that go quicker than we would have done when we were younger. I'm looking at you because you're younger.
I do.
Sorry.
You do. I'm sorry.
This question resonates with a lot of you guys as well, and that is that when you do come across people where you feel as though there is a sort of a semanticization element, or that people are very wedded to this idea of cure, which of course seems rather unachievable, but what you really want to do is kind of get them to a place where they can manage that pain, they have some power over the pain, and more importantly that they, and relating to what your own experience, where they need to sort of relate to that, or at least partly relate to that pain as something that's going on in their life. Do you have any choice language that you kind of use to try and to reorientate that, because I think from my perspective we're all being tainted by our own experiences where the communication hasn't gone particularly well, whereas you try to readdress people to the idea that in actual fact that there isn't a cure on the table, and that perhaps this may be related more to their psychological or emotional states.
I suppose I have some catchphrases, but it's important that you develop your own and use language that works for you with your clients. I don't always get it right. That's for sure. So this person I'm talking about that I sort of anonymise a bit, so you'll never recognise who this person is. But you know, the one that's completely surprised at the mind and the body, you can express, you know, anxiety through the body, I'm a big believer in kind of communication being shared, and I remember, so I copy my letters to the GP, to the patient, and you have to use reductionist terms, because when you're busy writing up a session or something, I don't know if you guys have to do that, but you know, I'd sort of say, well, you know, this is quite neurotic, you know, but and he took real kind of umbrage with that, but then it was quite useful because it did spike his curiosity into it. And then that led to another conversation. I think I'm very much using hands all the time, as you're already sort of witnessing, sort of mind, body. It's like that, you know. And sometimes a picture is just better than stuff. If you were doing a therapy contract with someone, you'd give them homework to explore these things during the week. You know, during the week when you have a stressful circumstances, notice what does your body do. So you can give a little bit of homework. I'm not saying you have to go and prescribe that. That's people's learning is more powerful if it's their own. But in terms of catchphrases that are quite helpful.
Well, I have one that is a good one to avoid before unpacking. Usually when someone comes in, I try and avoid saying, "How are you?" Because that's either
It's a dangerous question.
It's either very, "Yeah, I'm good, yeah, whatever," or they actually start unpacking. So most of the time I'm going to say, "Good to see you," and then come on in. So that's a good catchphrase to keep everything on time as well.
I use a meta perspective, and I don't think I'm really great at it, but you know, I often talk about like, what's your mind doing? So if someone's really anxious or worried or distressed, you're like, well, what's your mind doing now? To sort of distance themselves from, you know, people sort of think that their mind is them all the time, but our minds are quite crazy and throwing up all sorts of stuff all the time, and that's just what minds do. Similarly, like, what's your body doing with this? You know, just to sort of develop that kind of meta perspective, because otherwise people are like blinkered horses. They just think that how their mind is the way the world is, and if my body is experiencing pain, then there must be a problem in the back. So if you try and sort of just develop that kind of that language that helps them think of it in those terms, what's my mind and body doing with this? You know, so it's pretty. I don't know if that answers your question very well.
Yeah, well, it's therapy where you self-analyse and realise that your mind just works on repetitive cycles of established patterns.
Yeah,
it's good.
That's bad language when I've got that wrong. So it's if you confront like mind body sort of dualism head on, it's really helpful, you know. So if you give people lectures, well, you feel this because of that. That's usually not experienced sort of too well. And then people, if they sort of got pain and they're in distress or depressed or anxious, all the rest, then their ability to kind of understand your perspective will be diminished. So in sort of psych babble, we call that mentalizing, just that ability to understand your emotions. And when we're full of our own emotions, their ability to understand your intentions and emotions is impaired. So if someone's coming in and they're kind of, you know, they've been battling this chronic pain for ages, or they've had something in their life that's just gone wrong, and you know, you're saying, well, it's all just experience, this distress has been experienced in your body, they may interpret that in many ways. So the correct interpretation is you're trying your best to make sense of their problems and think about it with them. But if they're full of emotion, pain, whatever, they might think, oh, here's another lecture about what I'm doing wrong, you don't understand it, this is what my wife's been saying, have you been talking? You know, people when they're full of emotion will go that way.
Yeah, very good.
Well, wives send their husbands in, right? Like, I don't know what happens down here, Priya, but you know, you better fix him. He's, you know,
But we all do it. And the other thing too is just to humanise it. I mean, I don't think, there's always a bit of a danger in talking about it from your own experience, and I don't think you should really do that. But you can use your collective experience with other people and reframe that. So particularly when people are anxious, and you're talking about somatization and things like that, I always say this is quite normal. We all experience kind of emotions through the body. That's normal. We all do that. Or, you know, the anxious mind will become like a blinkered horse and will start to just, you know, be focused on body sensations that are quite normal, but the anxious mind will be worried about those normal sensations. So, I mean, that's the case based on experience with my patients. And just to sort of tell them, you know, that you're not the only person going through this, that this is normal. No one's accusing you of anything, which can be helpful in terms of.
So just on that, say when like to these guys, we always catch up at least once a week, but sometimes people come in and they've just lost their emotional bearings. And often around pain. I mean, neck pain, back pain, and headaches are probably the 3 most common reasons why people would come into our office.
Yes.
And they're often in, you know, it's hit that crisis point, they've lost their emotional bearings, they're like, I need this fixed now. You can see the trail that's, you know, led up to this point, and, you know, if we could fix it now, that would be fantastic, but it's probably not going to happen in reality, you know. Not that I want to say that directly, but how do we slide in through that, you know, barrier that they've like, you know, got up without offending them or without feeling like they're not being listened to, so to speak? What's your tips around?
Well, I suppose the tip is that you're already configured to do that, and it's just maybe, so I mentioned this word mentalising, which we don't talk about it often because it's just so fundamental to what we do as humans. It's like breathing, you know. So like at the moment I'm making assumptions about all your emotional states. Oh, you're nodding, I think understood, or some, you know, you looked hungry, or, you know, like, or just, I don't know, I'm just making that up. But, and
no, that would be me.
So there's always assumptions, and because we don't have glass bowl heads, we have to make these sort of rough and ready assumptions all the time. And most of the time when we're calm, your ability to do that will be pretty accurate. If you're hungry, you haven't slept the night before, or if you're pissed off from something that happened, be aware that your ability to do that may not be so great. So really is just reflecting on that and being authentic. So I think it's quite reasonable to not say this is what you're feeling, or just to sort of say, I imagine that, you know, this has all been so hard for you up to this point. You know, just to sort of show that you are kind of mentalising about that difficulty. And what you're drawing on with those comments is what you're actually experiencing. Because if someone's coming in and they're despondent and angry and fed up and in pain, you'll feel that too. And then it's just really about sort of just reflecting on that and just saying, look, it just sounds like this last 12 months has been a terrible time, you know. And people will respond to that because they get a sense that you're trying to accurately understand them. And even if they may not have a sort of reaction to that in the room with you at that time, or they may misinterpret what you're saying and get a bit angry, they will later on think, oh, hang on, this person is trying to be accurate and sort of empathic with me. And that's quite powerful too. So, and again, a lot of it can be non-verbal, it doesn't always have to be verbal. You know, so getting the box of tissues, because you've got one here, I mean, that's quite a sort of powerful thing, just to sit there and let people have a moment and, you know, things like that. You don't have to come up with that magic thing to say, but just reflect your own emotions and just demonstrate that you're remaining with them on that. That probably sounds a bit sort of airy-fairy psycho, but that's fundamental.
That's like, it's a great response.
And it's, you know, it's part of our craft as well. And
yes,
we have to develop our own way of doing that as well.
So that's why one thing I didn't want to do today was teach you guys the psychiatrists, because there's a lot of wisdom here, and you're already brilliant mentalisers. If you weren't, you would not be doing the stuff that you do. You know, you just wouldn't. So it's, you know, not sort of throwing the baby out with the bathwater, just sort of giving you some concepts that probably give a language to what you're already doing already.
Another option, I don't know if I find it difficult. It's the clients who have chronic pain, whether they're highly medicated. It's about training them that I'm just here to facilitate. Like, this is actually your journey. This is your pain. Some of the right words.
Yeah.
Because they can be very shut down. They just want a pill. They want a trigger point, whatever it might be. And it's about educating.
Yeah. I think that's very, very important. Language is important.
Yeah.
And there will be that projection of some terrible thing that they kind of want you to own, you know. I quite like that idea of sort of baggage. I mean, it sounds like quite sort of pejorative now, but it's like when people bring their own emotional baggage. I always think it's like sort of a bag at the airport. You wouldn't go and pick it up and take it home with you.
Yeah.
But you've got to sort of try and say that this is their thing.
Yeah.
It's not my thing, but I'm here to kind of help you with that thing. You know, it's not in those terms, but it's sometimes as fundamental as that.
It is.
Yeah.
And it's just about training them up and I don't know whether you guys get a lot of that or it's that can be wearying too.
Yeah, absolutely.
Yeah. I mean,
Good question.
and it's consistency too. So, you know, in one session, there's a difference between seeing one off. And you hope that you sort of say some helpful things that will get them on the right path. But if you're seeing people over time, then you can just be sort of consistent. And you've got time for them to experience that as well as a truth.
Yeah.
So I treated recently who lots of problems going on with his life and back pain, chronic pain syndrome, that kind of stuff. And I only sort of saw him once really, because that was my role. But I did have to sort of push him a little bit. He was basically staying in his room, not wanting to come out and speak to me. And eventually I said, you have to get up and come and talk to me so we can both sit in chairs. And then I did have to give him a little bit of tough love and just say, you can't be passive in this. I've got to pull you forward. You've got to be an active partner in your recovery. Yeah. And it's important that you get moving, you know, because if you don't, it's going to be really, really hard to help you later. Yeah. I mean, all know that's the truth. Yeah. So it's not that you're sort of saying, sometimes I think truths are truths and you don't have to kind of edit it too much. We know that people don't, you know, you guys are more the experts of facts than me, but you know, that if you just stay in bed and do nothing, for more than 6 months, you're doomed really in this having, you know, a cure, you know. But like medicine and all of this, it's always been based on interpersonal. You know, even if you're a surgeon who's very technical and, you know, known for doing their procedures, of course you want a surgeon that knows what they're doing, you know, when they fix this or that. But it's always been based on relationships, you know. Medicine is relationship based. GPs know this, that, you know, people, a majority of their consultations are people coming in with sort of distress about their lives. They might come in with an earache or a toothache or whatever. So just again, just being present and hearing people and listening to the stories and demonstrating that a curiosity about a problem is very powerful, because the corollary of that is true too. It doesn't matter how great you are in terms of your skills or practical skills, if you're not sort of experienced, if you're not good at relationships, professional relationships, it's all just not going to go anywhere. And it's always been the case with medicine and pain management. Fortunately, we talk about this more now. We didn't sort of think about it before. The impact of COVID on mental health. What's your perspective on this? I think
we can stay clear of COVID if you.
Oh no! I don't have a sort of a huge amount to say about this because again, this is quasi-fluency. It's a mental health epidemic and all this. I think it just highlights what we already know about health, mental and physical. That, you know, particularly social stuff. Like we're totally social creatures, and what COVID has done, not so much in Australia, but certainly overseas, is that, you know, repeated lockdown, or Melbourne, I should say, you know, that we depend on social contact to maintain our health, and it's fundamental. So if you've got a choice in terms of, this is your choice, you either have to smoke kind of 20 cigarettes a day, or be lonely. This is a loaded question. What's worse for your health? It's the loneliness. That people who are lonely die sooner. and it's worse, has a worse effect on your health than smoking cigarettes. And it's not just whether people say you're lonely, it's whether you feel lonely. So even if you're visited by your son 5 times a week and you still feel lonely, that's what's important there. Because some people might get a visit from the son twice a year and they don't feel lonely. Do you know what I mean? It's a very personal concept. But I think COVID has shown that if people are lonely and don't have those restorative interactions with people who are important to you, then health suffers. So it just sort of illustrates that relationship, a very clear relationship. And it's funny that the world hadn't really thought about that until COVID came along, which was a bit weird. And of course, my main interest, and probably Tom's too, is like people in nursing homes, because people are very, very lonely in nursing homes, and if their relatives can't get in. I'll be a little bit political for a second. I mean,
We'll do so.
just this anti-vax brigade. I won't use 4-letter words, and I just think, gosh, have you ever visited a relative in a nursing home when you've had to show your influenza vaccination to get in the door? Like, I think, who are these people? This idea that this vaccination thing is something new, when, to go into a nursing home, you've had to show your demonstrated vaccine. I just, that just perplexes me. Yeah. But I'll stop talking about that, otherwise I'll get a bit cross. Mentally healthy, so we can better help each other. We've spoken a lot about this, really, and we sort of, and just with the activity, when I talk to people about healthy activity, I put it in order, and I always say, actually, social activity, physical activity, and then mental activity in that order of importance, mostly in terms of people having memory problems and early dementias and things like that. And if you think about it, in terms of that social activity and physical activity, that's what you guys are doing. So you're actually doing the most important activities, I think, in terms of maintaining kind of health holistically. Because every session you will be talking to them, there's social interaction, there's physical therapy. So in terms of like holistic ways of managing mental health, you guys are better at it than me. I think France, probably Germany too, they're much better of realising that to sort of deal with someone's health, you have to deal with all components. And so, if you are sort of depressed in France, it's very common that, you'd be recommended to go for a retreat for a weekend, or, and have massage and sort of sauna and all that. The Germans are good at that particularly. But, we're really, really rubbish at it here. And everything is so siloed, it's crazy.
Why are we so rubbish?
Why? Because this is the consequences of like the way that sort of health and social care are being organised. For decades. Poor old Tom's heard me go on about this, because it's just the way things are. So I mean, I'll throw some more politics into it. It's also a bit post-Thatcher as well, because Thatcher was the one that's saying, we're all too expensive, and we need to inject market forces into things, that way we'll get kind of economies. And the consequence of that, you've had sort of splits in terms of physical health here, mental health there, and we're all kind of competing against each other for a smaller slice of the pie. And that's been kind of the way it's been for 40 years.
So it's going to become more holistic? You can see it going that way?
Can
anyone see that? Or?
What do people think about that?
You go.
We're starting to talk about it, which is good. I like to think that towards the end of my professional career, we'll see more about that. I mean, certainly, I worked in the UK for like 15 years, and so a lot of my experience is based on that. And GPs, primary care, are the ones that sort of understand that you've got people coming into their practice complaining of back pain, just giving paracetamol and stuff would you limit it. So they will do prescribing for a gym, or social prescribing, or that's a sign of things getting better. Whether I would see it in the role that I do, because I'm in the mental health silo, why on earth would I be concerned about what happens with the body in massage? So, and the budget's this big, you can't spend it on that. It's crazy. But I think we'll probably see at some point more personal budgets, that people kind of will enter healthcare and they'll have a conversation saying these are the things that could be helpful, and what I like them to say, I'll have a little bit of psych, a bit of chiropractic, a bit of massage, so if people have control of their own kind of recovery, and that's progressing slowly, then we'll see more of that. But there's lots of reasons that would maintain the status quo as well. I'm trying to be positive.
I don't know if it's getting better or worse really, but it's changing anyway. So I guess just talking about medicine, at least the way I know it, is that there are technologies growing at 1 million miles an hour in different areas. Oncology, interventional medicines, understanding of molecular and biological processes. And in some respects, it takes you further and further away from this mind-body interface that Noel's been talking about. And it needs to happen, right? But the further you go down that, the farther away you actually get from the person you're treating. But yet in saying that, there is a growing recognition, particularly in certain specialties, pockets I call them, or silos in healthcare and within medicine. People are terrible at talking to each other, so it's nice and very refreshing to meet all you people and also hear Noel's perspective, even though I see him every week. Because there are certain pockets, palliative care, psychiatry, general medicine, general practice, but also in allied health and chiropractic and so forth, and that really do kind of get it, and it's trying. The challenge I think we have is to try and bring it all together and make everybody kind of understand where it all fits together.
Yeah.
But there's no structure to do that. So it really relies on this sort of grassroots dialogue, I think.
Dean, to get the best out of them. So I'm hoping that we are heading more towards being a multidisciplinary.
Meet on a Wednesday morning to sort of talk about shared people who have mind and body issues. And I think, to my knowledge, we're the only service in WA that does that. And it's not rocket science.
Yes.
That's
So
right.
this kind of thing is the way forward. And again, GPs are great. They're very happy to get input from anyone. I think I am too. So yeah.